morning, good afternoon. I am Liz Powell. I'm the founder and head of G2G Consulting, and also founder of the Women's Health Advocates, along with these amazing women all on the call with me today. I am juggling some things today, so as you can see, I'm in my car. So my esteemed colleague, Katie Collins, is going to help me out today, along with my other teammates on the leadership team. Katie's an amazing, amazing person, just a human being, very inspiring, awesome human being. In addition to that, she is our vice president at G2G Consulting. She has an amazing background working in the White House, leading very critical and successful lobbying efforts to increase funding for NIH, which I know we all care about deeply. She knows how to get things done. She's an amazing leader. So she is going to lead the call with Beth and Netta. And I'll be on for a bit, and then I'm going to have to step away. So thank you all for dialing in, and I will pass to you, Katie.
Oh, thanks, Liz. That was such a kind introduction. I'm going to have you introduce me around more often. But hi, everybody. It's amazing to see so many folks on. Welcome to today's Women's Health Advocates call. As Liz says, I'm Katie Collins. I'm a vice president at G2G. I lead our federal advocacy work. I have a background in the health space. I spent about 6 years in the Obama White House, and then was the program director at the Biden Cancer Initiative for then Vice President Joe Biden before doing some work for NIH. So I feel very passionately about health issues, and in particular, women's health, which is why we are all here. And I think we are going to dive right into some of the legislative work that we're doing. So just to give folks a gist of what the agenda will be like today, we're going to share our legislative plans, our outline for the next several months or so. And then I'm going to let Dr. Jocelyn Fitzgerald share a little bit of exciting news. And then Sally Wolf is going to talk a little bit about LinkedIn presence and social media. And then Dr. Beth Garner, I think, is going to do a recap of, or a look ahead, I guess, at events for the next couple of months and where women's health advocates will have representation. So with that, let's get into legislation. So despite the fact that our government hasn't been able to wrap up funding for FY25 yet, despite the fact that it started over 6 months ago, we are getting ready to dive into fiscal year 26 budgeting. And the reason that that's so important for us, for this group, is that that is the piece of legislation that in a normal world, which I know we're not in, but generally has to move each year. So it's a really good place to work on policy insertions and funding, because it's going to move. It has to move unless they're going to do a continuing resolution, which can happen, to fund the government. So we are getting ready to dive deep into what's a very intensive process. It'll be most of March, April, and May. And we are going to be asking for $200 million, $200 million fund for women's health research and coordination across all of NIH. And the way that we advocate for that inclusion in the budget is to essentially fill out an application form with this request to a whole bunch of offices that have jurisdiction over the bill that governs NIH, which is the Labor, Health, and Human Services bill. So we will be targeting members that sit on those subcommittees in the House and Senate. We will be targeting members that care about women's health, who might not sit on that actual committee, but are going to make their voices heard and put in a request in this space. So each of those offices has their own application that we will be filling out. And then we'll also be meeting directly with those offices to educate them. The form has to go into their system to be considered, but we also have an opportunity to make huge impact is the face-to-face sit down with the staffers in each of those offices. As Liz knows from being a staffer on the Hill, staffers have incredible power. They are often the one making the decision ultimately when it comes to their portfolio about what they're going to be advocating for, about what their recommendations are going to be to their bosses. So we will be sitting down with those, with each of those offices to talk about women's health, to talk about the gaps, to talk about the need for funding and coordination across the federal level, particularly at NIH. And then Liz and I and a couple other members of our team and other advocates here are going to be sitting down directly with members of Congress, whether that's at a coffee or a dinner, explaining directly to that representative or senator about why this request is so important, the impact it will have, and why they should be supporting it. So that, I mean, really, again, March, April, May is going to be appropriations work on the legislative side, and we're really excited to get going. I think we had the first form due last Friday, so the work has begun. And then I wanted to talk about a couple of events coming up on Capitol Hill over the next several months or so. So April 23rd, we are doing a congressional briefing with the Breast Cancer Early Detection Coalition, which is a subgroup of women's health advocates. It's going to be online, so it means that as many folks who are interested and want to join in, show their support for this issue and learn more, there will be that opportunity. So you'll be seeing more from us on this particular event with the way to sign up, but that will be April 23rd. And then on April 29th, we will be having an in-person congressional briefing on CMS reimbursement and how it impacts women's health. That will be on Capitol Hill. And so we welcome, those in the DC, Virginia, Maryland area to come join us. We will be inviting Hill staffers. That's really our target audience, is to share policy recommendations and ways that members and their staff who care about this issue can make a change. So that's April 29th. And then finally, May 21st, we are planning a Capitol Hill Day with an in-person briefing. So same kind of format as the April 29th in-person briefing on CMS and women's health. But this will be, more generally about all of the different issues we're working on, followed by meetings with members of Congress and their staff, and then a reception. We are working to get some high-profile government folks there. We would love to honor the wonderful women at ARPA-H who have made the Sprint for Women's Health so successful, and have been talking about potentially getting Dr. Biden there to thank her for her work, spearheading the White House Women's Health Initiative. So just to recap, April 23rd, breast cancer early detection online. Anybody can join. So please register. We'll make sure you have the link. And then April 29th, CMS and women's health in person on Capitol Hill. And then May 21st, Capitol Hill Day, briefing, meetings, reception. We're really, really excited about that, also in person. If folks, I'm realizing I'm saying a lot, so if folks have questions, we are going to do some Q&A at the end, but there is also the Q&A button feature, so if you have questions, you can put them there too. All right, Liz, did I forget anything? If I did, please feel free to jump in. Okay, hopefully that means I got it all. So with that, I'm going to turn it over to Dr. Jocelyn Fitzgerald to share some exciting news.
Well, I mean, I don't know if it's how exciting, but I think it's exciting.
I think it's exciting.
Hi, everyone. I actually just put in the chat, we had So those of you who have maybe not been on the call before, I'm Jocelyn Fitzgerald. I'm a urogynecologist at the University of Pittsburgh, and also work with many of you at the McGee Women's Research Institute. And me and an incredible team of researchers that includes Louise King, who's a lawyer and a GYN surgeon. She's the head of reproductive bioethics at Harvard. She's really sort of been, in many ways, my mentor in this push. She's been working on this for a long time, but we've been working very hard on the issues around gynecologic surgical reimbursement, and specifically like OBGYN reimbursement within hospital systems, as it relates to the way CMS actually like caps that number. And it's sort of a complicated system between CMS and the American Medical Association, but the summary is that OBGYN, the amount of money that can be made from women's health services in hospitals, has been stagnant for a long time, and if anything is getting worse. And when you compare it specifically to like male procedures, like equivalent OB, we can't really do it so much with OB, but like with gynecology, you can take pairs of equivalent male and female procedures and see how much more money, literally revenue, male procedures that are literally like matched pairs will generate for a hospital system. And so we published a paper that I just put in the chat that was officially online and available to the public as of a week ago, I believe, where we published that research that shows we picked 50 matched pairs of surgeries and showed that on average, male procedures reimburse 30% more money than female procedures do, and as bad as like almost 150% more. So that means a lot in terms of keeping women's health services afloat within the healthcare system. If you're not a moneymaker, unfortunately, it's not, I think nefarious on the part of a lot of these systems, but it is the system. And women's health is going to be leapfrogged by urology, by orthopedics, by plastic surgery, by pretty much everything else that generates more revenue for no reason, for no reason related to skill of the surgeon, the amount of time the surgeon spent in training. In fact, it's actually incentivizing surgeons with lesser training to do worse surgeries. So that is also like affecting our patients, of course. Like I just saw a patient 20 minutes ago who came to me, and she was about to have the wrong operation, like out in the community. I mean, last night, actually, I told Liz about this. We're trying to get a patient to come to this panel on the 29th to talk about how they have gotten a hysterectomy when it wasn't indicated, but in fact, they needed a different operation with a more highly skilled surgeon. And the reason that didn't happen is because largely of reimbursement. Within 3 hours, the number is now up to 9,000 patients in a matter of hours who volunteered to be our patient advocate on this day that we're having on April 29th. Patients who had, frankly, the wrong operation, and the wrong operations are being driven by this reimbursement issue. It's also driving GYN surgery in general and obstetric services out of hospitals, especially rural hospitals with labor and delivery units are closing. And it's really all tied to reimbursement. If women's health was a moneymaker like orthopedics is, the doors would be wide open. They'd be building new surgery centers, they'd be building new labor and delivery units, but they're not. And a lot of this is because of the CMS codes and laws that keep a cap on the amount of RVUs, which means the amount of money that any specialty can generate. So hopefully that wasn't too long-winded, but CMS, when we met with them back in November and December, even prior to all the madness, like really has said that our data is irrefutable. And now we have this paper to show it, that it's completely irrefutable how inequitable this is. You can always sort of like, you can't really explain away these paired, matched, like perfectly mirrored procedures between men and women, and that the male procedure reimburses 30% more. So I think that kind of like black and white disparity is going to help get us really far in this on the 29th and moving forward. There is an awesome reimbursement day that's happening actually in New York next week. A lot of like awesome stuff that I've heard from Liz and Katie and Jody Newhouser and people that have worked and like are talking to people behind the scenes that even people like deeply connected to HHS right now are like aware of this and saying like, we can't deny this exists now that we have this data. So I guess that's the exciting news, is now we have this like thing in hand that's been published that we can take and really hopefully change this. Because, you know, it's not just about like OBGYNs getting paid what they're worth, which I think they should, obviously, as one, but this is a public health crisis that's driving women's healthcare into the fringes, into a cash-based practice. And very few women, if this continues, are going to be able to afford gynecologic surgery. So I truly think it's like second only to maybe reproductive justice issues, the greatest, and it's tied to reproductive justice issues because those things clearly don't reimburse well. But I think the biggest public health crisis I can see facing women that no one's really talking about. So thanks for listening.
Thanks
Very
for
exciting.
doing
And thank you
that.
for your support.
And data matters, right? Data gives us what we
Yeah.
can take to make these changes. So that is huge. So
Yeah,
thank
it's
you for
huge.
sharing that.
Yeah, I hope that if anyone needs me to email them the full PDF, if you can't get in through the link I sent, I'm happy to send it out.
Thank you. All right, I'm going to turn it over to Sally Wolf to talk a little bit about LinkedIn and social media and how that, ties into advocacy and how we can use that for all different parts of the important work that we're doing. So, Sally.
So thank you for having me. And so when we hear about amazing stories and work like what Jocelyn just shared, and Katie, everything you ran through that's on the upcoming spring agenda for this group, how do we amplify those messages? And I'm sort of an accidental social media expert. I didn't set out to be a creator or an influencer. I don't even fully understand that word. But about 3 years ago, when I created my own business and I saw LinkedIn was becoming more than just a resume tool, I started to post. And at first it was about work. And then I quickly realized that there were opportunities to share personal stories in meaningful ways that were really gaining traction. So LinkedIn has about 1 billion members, about 1 to 3% post at all. I know the faces I see on the screen, a lot of us are already doing that, but how can we do it better? And I'm seeing Beth Garner's face right now. And Beth, I know you just participated in the practitioner day that LinkedIn hosted. LinkedIn, healthcare is a vertical they care a lot about. And I know several people here also straddle technology. That's another vertical they're really trying to amplify. So they are eager for our stories. And the flip side of that is LinkedIn can be a little wonky. And I'm guessing most of you have had experiences where you spend a lot of time on a post and it's not seen by anyone, it's seen by 30 people or 100 people or even just 1,000. So I'm going to share some best practices. The key to remember as we build WHA, as you build whatever you're building, is LinkedIn cares a lot more about the personal story, the person posting, than about the company or the entity, even when we are working collectively towards something. So for example, if you look up Sarah Blakely versus Spanx, you're going to see her posts outshine Spanx's. And so I want like that to sort of be one of the main takeaways, because I think there's a lot of opportunity for us together. And so quickly, I'm going to go through things we could do profile wise, post wise, comment wise, and analytics wise. I have about 3 minutes, so I'm going to talk really fast. Hit me with questions. I can always do a part 2 and share all of these notes. Our profiles have so much more opportunity to be discovered now, especially with AI and because of some of the real estate that LinkedIn has provided. Use the cover photo area in the background. You can even put the WHA logo or other things you're working on, but that is seen by everyone. Also seen in your headline, you get 220 characters. You can write you're a member of Women's Health Advocates. You can write other things up there. SEO is optimized to find it. And the key thing to know, the first 30 or 40 characters of your headline are visible every time you make a comment. So the best way to be discovered on LinkedIn isn't always through your own posts. It's actually through comments you make elsewhere, and it's through things that other people are seeing when they're searching. So use those characters to your advantage, and you could put other stuff in there. I have Auntie in there because that's really important to me. And other people like to connect with people in personal ways too. Use the 2,600 characters in your about section, and in your featured section where you can choose posts to feature, you can choose to feature that you joined WHA, for example. Make sure you put that in your profile as effectively as a job, because those announcements from LinkedIn are the posts that they amplify most. So when I posted about the Early Detection Breast Cancer Coalition, I got hundreds of likes and comments, and it amplified it into everyone's feed. And use those to really write about why are you there? Because that's what people really resonate with. And you can check what's working and tweak it. So you can see how many search results you appear in each week. If that's going up based on something you did, SEO is liking it. If it's not, tweak it again. You're getting real-time feedback. And on the post side, so that's a little bit about profile. On the post side, LinkedIn is different than other social. They're not looking to make your post go viral. It's incredibly frustrating. I can tell you, the harder you try, it's probably gonna, like, they know you're trying and it's gonna ding you. So don't overthink it. Yes, they like things like hooks, and I have had things get relatively viral, I think as far as 500,000 views, which at the time I probably had like 11,000 followers. But don't try for viral, try for expert content. They are a platform that wants you to show your expertise. And the most important thing you could do is be thoughtful about when you post, and then also not overpost. Because if you post too quickly back to back, you're going to basically cannibalize your first post, and LinkedIn is going to think you're sort of spamming the system. So the best thing you can do is post when your network is on. So if you're wherever you are, if you're in the US, probably like 10 a.m. Eastern is ideal, because you're going to get East Coast and West Coast people beyond. The reason that's important is LinkedIn basically uses the first hour as a golden hour to test whether your post is valuable to your first degree contacts. And if it is, it amplifies it further. If it's not getting traction with likes and comments, it squashes it. So it matters if you get early engagement. And it matters when you share from your heart. It doesn't have to be lengthy, but personal stories resonate. And they love the why you got here. Why did you join WHA? Why are you here? What can other people learn from that? All of that is really valuable because it's seen as professional expertise, which again, it's a platform for professional thinking and thought leadership that's really helpful. Ending with a call to action, a CTA, if you've seen that term, is really helpful because it makes it really easy for people to engage. And you want people to engage because, again, that's going to show LinkedIn that people are enjoying your content and they're going to bubble it up. And that's how you get to those second and third degree contacts, which builds whatever you're saying, whether it's about WHA or your day job or whatever it may be, into other feeds. Also, on the top right, if you look at a desktop or a laptop version of LinkedIn, you'll see the top stories for the day that are trending. Jump on those, especially when they're in the health space, because LinkedIn will amplify your post or your comment into the feeds of potentially tens of thousands of people. So make it relevant to you. There's a reason you're chiming in, but it can be valuable. And don't overly tag, don't overly hashtag. So tags are okay, but LinkedIn sort of dings you when they think that you're trying to like get a lot of attention from certain people. So for example, famous people or people you may or may not know, or even if we were to overly tag each other, it sort of becomes like an echo chamber. It limits where the posts go because it's continually the same people being tagged. So try to minimize the tags when they're not directly relevant to the person. But you can let people know to engage and things of that sort. I'm kind of quickly going through my notes because I'm seeing the time. I'm going to leave out anything else. The last thing I'll say, I'll just reiterate the comments. The more you comment on posts that are relevant to you, you will be amplified outside of your immediate network. We will be amplified outside. And the last thing, going back to the Sarah Blakely and Spanx example, when WHA posts or the Early Detection Coalition posts or any of your businesses post, for whatever reason, even though it's a professional platform, LinkedIn doesn't amplify those in the same way that it does individuals. So posting as you about the event, about the coalition, about the advocates, tagging the advocates so people know they can go there, but that's more likely to build our presence than posting from that account. because that's going to really be seen mostly by the people who already follow it. I went really fast. Feel free to connect to me or ping me with questions, but I'm going to hand it back to Katie because I know we're not done yet.
We're not done yet. I know we're at time. We have just a couple of quick other things. I'm going to turn it over to Dr. Garner. She's going to run through just a quick stream of events of where you will see women's health advocates over the next several months. And then we'll take just a couple minutes for questions before we wrap up.
Thank you, Katie. And Sally, Jocelyn, just incredible, both of you. Really, really, so great. So I'm going to just fly through, okay, around, just as you said, where we're going to see our group in various events. So really exciting stuff happening. So March 13th, pretty soon, Katie's going to be speaking to Putin. That's how I say it. I'm not sure if that's the right way, but that's
how I say it too.
So this is a network, a really interesting network, actually, of really some of the most senior women who are in private equity. And they want to make some changes, obviously, around more investment in women's health, in women and women's health. So that's an exciting one, and really great that Katie is speaking there. And Liz will be speaking to the same group, but in the mid-Atlantic in DC in March 26th. So March 13th and 26th. On the 24th, really, I think a really exciting event as well. This is going to be in New York. It's the Power of X. And there are going to be a few of us speaking there. And there will be a leaders committee that Liz is putting together before the event starts. So you'll get further information there on timing. March 28th, I think you may have heard about this one already, but there's a healthcare world congress that's taking place in Waltham, Massachusetts, that's actually being done in conjunction with the American Medical Women's Association. And I was supposed to be there as a former president of that organization, but sadly I can't make it to this one. But this is going to be, I think the Congress is going to be great. That's on March 29th. And then the day before that, there'll be a committee meetup in Boston. So that's going to be really great, I think, as well. Netta, the amazing Netta, will be speaking for the Health Equity Innovators Summit in San Francisco, April 10th. And then in the spring and summer, we'll be looking at some planning for further events in San Francisco. That's it for today.
I think that's enough. Yeah.
Sorry, I just wanted to jump in to say that for the Breast Cancer Early Detection Coalition, one of the core leaders there at the Brem Foundation, Claire, they're having their Check Out My Rack event tonight. And I put the link in the chat, and I encourage everyone, if you are around this evening and you want to be a part of really supporting an incredible foundation, please click on that link and join so we can support Claire and the Brem Foundation.
Thank you, Vanessa. Anyone else have any other events to mention to the group? Okay. And this will be shared later, so you'll have the information. Thanks, Leslie.
Thanks, Beth. All right, I wanted to touch on at least one question from the chat or from the Q&A feature, my apologies, about how can individuals provide input on federal funding priorities. Noting that there is the portal submissions form that we, will be filling out, but also, touching on how important constituent input is, which is totally true. So how can individuals advocate for FY26 appropriations? There are several, I'd say easy ways. You can call your office and let them know you're a constituent and let them know what you care about. You will talk to a staffer, but they do have to write down what, where you're from and what you're calling about. And that does all go back to the member. I will say with everything that's been happening, particularly with DOGE recently, Hill offices' phones are ringing off the hook where they're having a hard time answering. We're hearing that they're getting as many as 40 calls a minute. So it's, people in both Democrats and Republicans are concerned, especially with the most recent access to the Treasury and to Social Security. So it may be hard to get through. So another way you can do it is they usually have like an email submission portal or template on their website. So you can go in and you can say who you are and where you're from and what you're advocating for. I will say we have had a couple of requests for this kind of how can I help at a more local or grassroots level. So once I think we get through this appropriations push where we'll be very busy with these requests, we are going to work on a toolkit that we can give out to put some of this in writing and make it more tangible for folks. I see one more question, and then I think for the interest of time, we will end the meeting. But are there Republicans in leadership who are supportive of these efforts? Yes, there are Republicans in leadership, and they're very important. When it comes to women's health, obviously on the Republican side, Senators Susan Collins and Lisa Murkowski have both been very vocal about women's health being a priority. Senator Capito, who chairs the Health Funding Subcommittee, is a women's health champion. I was just meeting with Senator Cassidy, who is the chair of Senate Help a couple weeks ago, and they are really wanting to do something around women's health. So I think the education is working. I think the more people that are speaking about how women's health differs from purely reproductive health is eye-opening to these lawmakers, and that they can see that there are things that we can be doing. Right. I want to thank everybody for staying a few minutes over time.